Comparing healthcare systems, United States versus Canada. My name is Tavis Grimes, and today's date is 9/13/2025. Today, I'll be comparing the healthcare systems of the United States and Canada. Even though the two countries are neighbors and share similar levels of wealth, their approaches to healthcare are very different. The United States has a mixed system that relies heavily on private insurance, with government programs like Medicare and Medicaid covering specific groups. Canada, on the other hand, has a single-payer universal system funded through taxes. My goal is to highlight these systems differ in terms of funding, access, costs, and outcomes, and to show what lessons can be learned from each. To follow up with that, a little bit more bulletin points. US and Canada share a border, but they have very different healthcare models, such as explained. In the US, primarily private market driven, with public programs such as the Medicare and the Medicaid. And then for Canada, single payer universal system funded through taxes known as Medicare, which is in not Medicaid, Canada, but in Canada. And then the purpose is compare key differences in structure, funding, access, and outcomes. For historical development, the healthcare systems we see today were shaped by different histories. In the US, employer-sponsored insurance grew during World War II when wage controls made benefits more attractive than salary increases. Later, Medicare and Medicaid were introduced in 1965, but no universal system was created. In contrast, Canada's path was different. Universal healthcare started in 1947 and expanded nationally with the Canada Healthcare Act in 1984, which guaranteed single-payer coverage across the country. The U.S. has historically framed healthcare as a personal responsibility, while Canada was treated it as a right. Funding and finances. Funding is one of the biggest differences in the United States. About half of the people, or half of our people, get insurance through employers, while others rely on Medicare, Medicaid, or buy insurance themselves. But even with these programs, the United States spends about 18% of its GDP on healthcare, more than any other country. Canada spends less, about 11% of its GDP. Their system is funded through federal taxes. Canadians pay higher taxes overall, but they don't have to worry about big medical bills because care is free at the point of service, which I feel like the United States of America lacks heavily. But that's just what we have to do with. Coverage and access. Coverage is another key difference. In the United States, there is no universal coverage. And about 8% of the population is still uninsured today, which I find kind of insane when you think about it. This often means people delay care or face serious financial risk if they get sick. Insurance coverage in the United States is closely tied to employment or income, which leaves gaps. In Canada, every legal resident is covered under the national health system. There is no uninsured population, and care is based on need, not ability to pay. This gives Canada more equity and access, which I feel like sometimes when I think about things like that, I feel like, why are we behind as a country? But then, are we behind? I don't, you think more people would be covered. I don't know. Cost to patients. For patients, the experience is very different. In the United States, high out-of-pocket costs are common. People deal with copays, and I don't work in the medical field. I work in the optical field, and Sometimes those copays can be a little ridiculous. People deal with copays, deductibles, and sometimes surprise bills, which is crazy. Prescription drug prices are also high, or the highest in the world. Canada, on the other hand, does not charge for doctor visits or hospital stays. Some costs do exist for prescription drugs, dental, and vision care, but these are often covered by supplemental insurance. The average spending person in the United States is around $12,500, while in Canada it's closer to just $6,300. That's nearly half, which is crazy when you think about it. As for health outcomes, when we compare outcomes, Canada genuinely performs better. The average life expectancy in the United States is about 76 years, while in Canada it's around 82. Infant mortality is also lower in Canada. However, the United States does have strengths. It leads in specialized care and access to advanced medicine technology. If you have good insurance, you can often get elective surgeries or specialty appointments faster than in Canada. But on a population level, Canada's universal access procedures, stronger overall outcomes. For wait times and efficiency, a common criticism of Canada's system is wait times, and it's probably because healthcare is a right, so that means everyone has access to it, so the wait times would be even longer. For non-emergency or elective procedures, Canadians often wait longer than Americans with insurance. However, for urgent care, Canada prioritizes patients based on need, and people don't go untreated due to cost. In the United States, wait times are shorter for insured patients, but the uninsured may wait indefinitely or avoid care altogether. So the trade-off is clear. The United States prioritizes speed for those who can pay, while in Canada prioritize equal access for all. Administrative complicity. The United States system is extremely complex. There are hundreds of private insurance companies, different billing codes, and requirements like pre-authorization. As a result, administrative costs in the United States are around 8% of health spending. Canada, by comparison, uses a single payer system where doctors and hospital bills one government payer, which keeps administrative costs at about 3%. For patients, this means fewer bills and less confusion. For providers, it means less time spent on paperwork and more time with patients. Public satisfaction and challenges. Public opinion also differs. In the United States, people often complain about costs and surprise bills, but once care is received, they are usually satisfied with quality. In Canada, people are genuinely satisfied with universal access, but they complain most about wait times for non-urgent services. Both systems face similar changes, though an aging population, rising drug prices, and shortages of health professionals. No system is perfect, but each reflects the values of the society. Individual costs and competition in the United States versus equity and fairness in Canada. For key lessons and takeaways. In conclusion, the United States excels in medical innovation, advanced technology, and choice, but struggles with cost and equity. Canada excels in universal coverage and better population health outcomes, but deals with longer wait times and efficiency issues. The United States continues to debate expanding coverage, while Canada works on reducing wait times and sustaining funding. Ultimately, these two systems reflect different philosophies. In the United States, or the United States sees healthcare as a market good while Canada treats it as a social right. Both offer valuable lessons for improving healthcare moving forward. Some of my references is Canada Health Act from 1984, Centers for Medicare and Medicaid Services, CMS reports, OECD Health Statistics back in 2023, World Health Organization reports on United States of America and Canada, and in scholarly comparisons. Thank you.